Dr. Stephen Parodi is the Associate Executive Director of the Permanente Medical Group at Kaiser Permanente, and he joins me from San Francisco. Doctor, thanks so much for being here. For you on the ground, you have some, 4.5 million patients across, I think it's 21 hospitals in California, a state that's seen, plenty of vaccine shortages. Is this a game changer?
I think this new vaccine is a huge game changer. First of all, it's a one-dose vaccine. It requires refrigeration instead of the freezers. So it's going to be actually much more mobile. We're going to be able to get this into the communities in a much more ready and fast fashion. It has minimal side effects, and it prevents hospitalizations and it prevents deaths. And that is really what we've been struggling with in California and in the entire U.S.
You say it'll be deployed, fast. So it's expected to roll out next week, possibly as soon as Monday. So concretely, then, how are you preparing? What are the logistics involved here to actually get those shots in arms quickly?
That's right. So, literally, we are hearing that as of Monday, we are going to see up to 4 million doses being released in the United States. And we expect about 10% of that be coming to California. So we've been ramping up both our internal operations in the hospitals, in our clinics, but also mass vaccination sites. So we've been having our personnel deployed in these facilities at the mass vaccination sites. And in addition to that, we've been actually getting out into the communities. So we've actually stood up community centers in churches or pop-up clinics in particular counties that have asked for our assistance.
Now, because the Johnson & Johnson vaccine has a lower efficacy rate, some people, they might see it as a second-class vaccine. The consistent message we've been hearing from health experts is, of course, the best vaccine is the one you can actually get. But how do you convince people of that? And you mentioned, marginalized communities. How do you approach it with many of them who might be suspicious that the rich or white people are getting the good vaccine and they're getting the bad one?
Well, I'll tell you, I have this conversation with my patients actually, and have been talking about this for the last couple of weeks in anticipation of J&J coming out. And the key thing here is that this vaccine prevents death, it prevents hospitalizations, it's going to prevent you from getting into an ICU. And quite frankly, it acts faster than even the Moderna and Pfizer vaccines. So it gets you up to really the immunity that I'm talking about in terms of preventing you from dying within 4 weeks, where it takes about 6 weeks when it comes to the other two vaccines. So I think there's a lack of, difference here in terms of when it comes to protecting you from what matters most, which is preventing death.
Now, we're still going to have to take, all the measures that we've been taking for months now, masks, social distancing. Things won't open up, obviously, for a while. Unfortunately, as we see, politics and COVID are inextricably intertwined, and we saw more evidence of that last night at the Conservative conference, CPAC. One of the biggest applause lines was when South Dakota's governor touted her state's record on COVID, then bashed Dr. Fauci. I want to listen to this.
We never focused on the case numbers. Instead, we kept our eye on hospital capacity. Now, Dr. Fauci, he told me that on my worst day, I'd have 10,000 patients in the hospital. On our worst day, we had a little over 600. I don't know if you agree with me, but Dr. Fauci is wrong a lot.
Now, and we didn't play it, but there was a huge applause after she said that. So I'm playing that not because it was an exception or an outlier. All throughout the weekend, all the big-name Republicans have been mocking mask mandates. The crowd booed reminders to wear masks. That anti-expertise, anti-science attitudes, they're still persistent and prevalent. So how much harder does that make your job as we still have to go through all these, go through with these measures?
It's been such a complicated messaging campaign when it comes to the disparate messages that are out there. Let me just tell you that I stand with Dr. Fauci. And when it comes to the science, we know that the way you protect yourself is by wearing a mask, washing your hands, and keeping your distance, and then getting those vaccines into arms. And we know it works, by the way. You see the contrast between the behavior that occurred with the Thanksgiving Day travel and then what happened at Christmas and New Year's, where people actually stayed home. And what we're seeing now is actually the benefits of that. We're seeing massive decreases when it comes to hospitalizations. And I think that's a combination of both the vaccination effort, but most importantly, because people have taken it to heart that we need to protect each other by following those good public health measures that we know work.
Yeah, well said. An important message. I hope people are listening. Thanks so much, Dr. Stephen Parodi. Appreciate it.
Thank you, Kim.
President Biden is calling on senators to pass his sweeping coronavirus relief bill. The House of Representatives approved the nearly $2 trillion legislation early Saturday morning. All but 2 Democrats voted for it, but no Republicans. Later Saturday, Mr. Biden said the government is now